Alright, this video is going to go over lower leg musculature. If you have not seen the video yet on bony palpation of the leg and ankle, you have to go back and watch that first, because all we're doing here is connecting bony landmarks. So I'm going to assume that if you're watching this, you know where those bony landmarks are. So I also recommend have the trail guide out and follow along so you can read origin and insertions while you're palpating and just make it easier. I'm going to use the textbook and go exactly what the textbook is saying just for consistency's sake. So while we're here and we have the lateral compartment readily available, we're going to do our perineal muscles. You have two perineal muscles, peroneus longus and peroneus brevis. All we're going to do is just going to find origins and we're going to find insertions. So peroneus longus, its origin is the head of the fibula in the lateral fibula. So we can find Mike's head of the fibula right about there. And so there would be his lateral fibula right there. So his origin is going to be there. And if he actually actively everts, you can say, hey, relax, come back. You can see the muscle belly pop out. That's peroneus longus. Now, peroneus longus is going to start right here, and the belly of it's going to come all the way down the fibula. It's going to wrap posterior to the malleolus, posterior to the perineal trochlea, which you should be able to palpate. And here's where it gets funky. It wraps underneath the foot, okay? So it starts posterior, wraps underneath the foot, and it's going to insert into the medial cuneiform in the base of the first metatarsal. How do we find those? Well, we know our bony landmarks. I can find them on the navicular tuberosity, which is right there, and then that means my medial cuneiform is right here, and right next to it is my base of the first metatarsal. So in theory, peroneus longus is wrapped around and inserting right there. All right, peroneus brevis, much easier. It starts about halfway down the fibula. It also wraps around the lateral malleolus, wraps around perineal trochlea, and it ends right here in the base of the fifth metatarsal, right there. So again, if you haven't palpated the bony landmarks before, you can see why you'd be hurting right now. So that's our lateral compartment, perineal longus, perineal brevis. Our next group of muscles are our anterior muscles. So we're going to have Mike just kind of keep his foot perfect, just like that. And I'm going to flip to it in the text. We have three of them: tibialis anterior, extensor hallucis longus, extensor digitorum longus. Anytime you see hallucis, think big toe. Anytime you see digitorum, think digits, either fingers or toes. So the main muscle on the anterior lower leg is tibialis anterior. So if Mike pumps like a gas pedal, you can see the muscle belly of tibialis anterior. It is easily the most identifiable and recognizable muscle. Anytime you have your patient, either in real life or in the practical exam, have them do the action and see if the muscle contracts. Easy to find that way. So tibialis anterior, its origin is the lateral condyle of the tibia, proximal surface of the tibia. So it's basically in this area. Matter of fact, dorsiflex, it's right there. That's its origin. It's going to come down, and you can see the beautiful, gorgeous tendon. It sticks out. You can almost grab it. And it also inserts into medial cuneiform in base of the first metatarsal. So it kind of shares an origin with the peroneus longus, which is wrapped around the plantar aspect of the foot. So there's my tibialis anterior. Next muscle, extensor digitorum longus. It's a little bit lateral to tibialis anterior, so it's kind of in this area right here on the lateral condyle of the tibia, and a little bit more to the fibular side. And if he extends his toes, which is hard to do, you can see that tendon right there. So there's extensor digitorum longus, and it comes down and it's going to insert into the middle and distal phalanxes of 2, 3, 4, and 5. So if you haven't done the bone video yet, you got to go back and find out how to palpate the phalanxes. 2, 3, 4, and 5, middle and distal. So it extends all your toes. Finally, extensor hallucis longus is kind of about right there. It starts in the middle, anterior surface of the fibula, interosseous membrane. So it's a little bit lower. And this one extends to big toe. So if he pulls his big toe up, you can see, actually do it a couple times, you can see the muscle firing right there. There's tibialis anterior right next to it. There's extensor hallucis longus right there, and it comes all the way down, and that bad boy inserts into the distal phalanx of the big toe. All right, so tibialis anterior, extensor digitorum longus, 1, 2, 3, 4, 5, 6, 7, 8, and extensor hallucis longus. When you're in your practical, I need to see all 8 insertions of digitorum longus. Don't cheap it out. Finally, the posterior muscles. We've already done gastroc and soleus, so I'm not going to waste time in this video. The posterior muscles are deep, so you really can't palpate them. So for the practical purposes, we're not going to palpate those 3 muscles. But on the written exam, they are going to be on a muscle worksheet, so you should know their origin and insertion. But what we can do is this area right here, which is posterior to the medial malleolus, is called the tarsal tunnel. And your textbook talks about this. There's a space between the Achilles tendon and the malleolus, and that allows the 3 tendons, tibialis, posterior, and the flexor tendons to pass through. It's actually called Tom, Dick, and Harry, and in class we'll talk about what that means. All right, but for our purposes, that's where the 3 tendons are. We can't really differentiate or palpate them, so for practical purposes, we really don't do a lot with them. But that's where the flexors or the deep posterior compartment pass through on the medial side. In terms of insertions of the flexors, that is fair game on the practical. And what I can ask you for, I might say, give me the insertion of flexor digitorum longus, at which point you should give me the distal phalanx of 2, 3, 4, and 5 on the plantar surface, because it flexes the toe. Flex your toes? Look at that. Woo, yay. If I ask you for the insertion of flexor hallucis longus, you say it's the distal phalanx of the first toe on the plantar surface. If I give you the origin of tibialis, or the insertion of tibialis posterior, you gotta give me all 5 tarsal bones plus the metatarsals. If you read in the book, tibialis posterior has a horrible insertion. It inserts into like every single bone in the foot, which I don't know why, but it does. So we really don't spend a lot of time in the practical on the flexors. I would spend much more time with your perineals, your anterior musculature, and your gastroc and your soleus. So those should be the 3 videos that you should watch for the ankle. 1 on bony, 1 on ligament, 1 on muscle.